Greetings, this is Golden Cloud Network, and today we're going to be talking about health literacy. I know you've heard about being literate, the ability to be able to read or write, but today we're going to be more specific. We're going to be talking about health literacy, which means being able to understand basic health information and services. Why is this important? When you understand basic health information and services, you'll be able to make better decisions for yourself, and this plays a critical role in the outcome of patients and their related conditions. Just like it's useful to know how to read, for example, you're driving and there's a sign that says stop. If you don't stop at the stop sign, you might be at risk of getting into an accident, right? It's the same when it comes to being health literate. That person who is driving is saved by their ability to read. They are literate so they can save themselves from risks. It's the same with health literacy, whereas if you have knowledge and understanding of basic health information and services, you'll be able to make better choices for yourself that will prevent certain risks from affecting you. So why is health literacy so important? Number one, it improves patient understanding and self-management. We know that doctors, nurses, and other healthcare providers are responsible for managing people who are sick or people who are diseased or people who are injured. But it is not only up to them. There's a part that you play as the patient. And to be able to fully contribute to that part, or to be able to fully participate effectively to that part, you have to have a basic understanding of what you're going through. Patients with higher health literacy are better equipped to understand their health condition, treatment options, and medication instructions. And this leads to better self-management of chronic diseases such as diabetes, hypertension, and adherence to prescribed treatments. And this helps to reduce complications and hospitalization. If you know that, okay, man, I'm diabetic, right? I need to maintain a certain diet. I need to avoid certain foods. I need to do this. I need to do that. If you have that basic understanding, it will save you from making the wrong decisions. And if it even applies to medication options, there might be a wide range of medication options. But if you have a basic understanding of medication, you'll be able to choose the right medicine based on the understanding of your own condition. So this is why health literacy is important. It helps you to make better choices, and it helps patient understanding and self-management. It's mostly about self-management because the clinicians are on a job, they're doing their job, but it is also up to you to save yourself. It is also up to you to play your part in saving yourself, right? Number two, enhanced communication with healthcare providers. This is a good one. So health literate patients can communicate more effectively with healthcare providers. How? They can ask relevant questions and actively participate in shared decision making. For example, let's say that your doctor recommends a certain treatment, and you recognize that this treatment is in a certain form. For example, you can be given injections or you can be given pills. You know that pills don't go so well for you. You know that injections don't go so well for you. If you ask the right questions, okay, doc, I understand that you're trying to help me, but are there other options that can be better suited for me? You know that you are obese, because when it comes to obese people, some veins are not easily found. So you ask the right questions, right? If you are health literate, right? So this also applies to fostering trust and ensuring that care plans are tailored to the patient's needs and preferences. That's the beauty of healthcare nowadays, that there's a wide range of options that you can explore. But sometimes it's not always like that. Sometimes you just have to follow your doctor's instructions. Sometimes there's only one road that is available for you to go with. So another reason why health literacy is important, it lowers healthcare costs. It lowers healthcare costs. How? Okay, so patients with limited health literacy are more likely to misuse medications. Okay, you can't even read your prescriptions. You'll be more likely to misuse these medications. Okay, let's not even go that far. For example, you don't know the value of 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 following prescriptions. This happens to most of us. It has even happened to me at some point. At some point in my life, where you take what you're given by the doctor for granted. You take medication and you start to feel better, and you start saying that, nah, I feel bad, I don't need to take. But the doctor prescribed you to take that medication for 1 week, but you stop taking it, and that will end up affecting you, and it will end up costing you more, because when that disease comes back, you have to pay more, instead of just following the prescriptions and saving money. So this is how it lowers healthcare costs. If you are health literate, you're more likely to your patients who have limited health literacy are more likely to misuse medications and miss preventative care appointments and require emergency care. Okay, it also comes to even attending healthcare appointments. That's how the health literacy also applies, because sometimes people just don't see the value of these things. People just don't see the value of attending appointments, So, yeah. And this will cost us if we fall under this category of people who are not health literate. We don't know why it's important to attend frequent meetings with your doctor. Okay, you've been operated, you've gone through surgery, you feel better, you're recovering. Your doctor says that, hey, come, let's talk every week, let's talk every month, let me check on you, let me ask you these questions. But you don't, because you've survived, because you've gone through the surgery successfully, you don't see the need of attending those meetings. So these are some of the things that are included when we talk about health literacy. So another point is better preventative care. Why health literacy is important. So health literate individuals are more likely to engage in preventative behaviors such as vaccinations, cancer screenings, and lifestyle changes. This is a big one. A lot of people might ignore vaccination campaigns. A lot of people might ignore screening campaigns. And a lot of people might stick to a certain lifestyle, which is known to be detrimental by people who are health literate. So if you're health literate, you know that if there are nurses that come to my neighborhood in a truck or in a healthcare vehicle trying to mobilize us to participate in vaccination, then we need to hear them out. We need to listen to what they're saying. It might help us. So this is how health literacy starts. The willingness to listen to professionals, the willingness to participate in certain healthcare campaigns. So this is beneficial in the sense that it is known to be better for preventative care, because it's not always about curing the disease. You can also prevent it. You can also prevent it by your lifestyle. If you're health literate, you know that living this type of lifestyle is detrimental to my body. You know how to prevent, and you know what to go for. So this also contributes to early detection. Early detection is a big one, especially with diseases such as cancer. If you participate in screening activities, because you're health literate, you are more likely to be saved, because screening can detect your condition early, which can help you to take the certain measures that can save your life. So another benefit of being health literate is reduced medical errors. Misunderstanding medical instructions or medication labels can lead to some errors in treatment. And health literacy helps patients to follow instructions accurately, reducing the risk of adverse events and improving. Okay, you're cooking, you're used to, you don't follow the recipe, that's fine. But if you're health literate, you know that, okay, I may not, follow put 1 tablespoon of salt in the pot, but when it comes, because it doesn't matter, you're used to freestyling and it comes out well, and that's great. But when it comes to medicine, you kind of have to follow the prescriptions as they are. So this is health literacy. Sometimes we take certain things for granted because we're used to doing things a certain way. But if you're health literate, you know and you understand that when it comes to health, I cannot do this. So health literacy also helps to empower the patient. And when the patient is empowered, they can take certain measures in their own lives that can help them make better health decisions in their lives. And lastly, this also improves the quality of life. Patients who understand their health conditions and treatments are more likely to experience better physical, mental, and emotional well-being, and this leads to an overall improvement of quality of life. So these are strategies to improve health literacy. One, simplified communication. Use plain language, visual aids, and culturally appropriate materials. Number two, patient education. Provide clear instructions and reinforce key messages during consultation. Number three, health literacy training for providers. Train healthcare professionals to recognize and address low health literacy. Number four, community programs. Offer workshops and resources to improve health literacy in underserved communities. And the last point, digital tools. Leverage technology such as apps and online portals to provide accessible health information. So in conclusion, health literacy is a cornerstone of effective healthcare delivery and patient empowerment. By addressing barriers to health literacy, healthcare systems can improve patient outcomes, reduce costs, and promote equity in care. Investing in health literacy is not only beneficial for individuals, but as a society for whole. So this is our presentation on health literacy. We sourced CDC and we sourced the World Health Organization on the points that we have integrated and used to create this presentation. Thank you for your time.